My name's Renae Bradford, and in this presentation we will be looking at a current nutrition issue, health at every size. Obesity is a growing concern in society today, with 63% of Australians now being classed as overweight or obese, and rates are continuing to rise. There are numerous health issues associated with obesity, including an increased risk of developing type 2 diabetes and cardiovascular disease, as well as some cancers, arthritis, and some musculoskeletal conditions. Public health recommendations encourage people who are overweight or obese to lose weight through dietary changes such as reducing energy intake and through increasing physical activity. This approach often produces short-term weight loss, but can be difficult to maintain long-term. Many overweight or obese individuals have attempted to lose weight repeatedly, but have been unable to sustain any weight loss long-term, so they don't achieve the health benefits associated with reducing their weight. These repeated cycles of weight loss and weight regain can produce a preoccupation with food and body image, low self-esteem, disordered eating behaviours, and poor health. In recent years, a method has emerged called health at every size, where the focus is not weight loss and dieting, but rather a weight-neutral approach to healthy living. HAES places an emphasis on improving health regardless of whether you lose weight, by adopting healthy behaviours such as listening to your internal cues of hunger, appetite and satiety, incorporating movement into your life, and appreciating your body and finding joy in using it. It's a movement for all ages, races and genders in all walks of life that recognises that humans come in all shapes and sizes and aims to be accepting of others, to connect with others and find meaning for your life. This presentation explores health at every size to determine whether there are proven benefits to this approach. In this report, I will aim to answer the question, do people following health at every size have improved health outcomes? To best answer this question, for my search strategy, I selected the terms people, adult, men and women for Concept 1. For Concept 2, I selected health at every size and HAES. And for Concept 3, I selected the terms improved health outcomes, health improvement, quality of life, and disease risk. The search strategy I implemented involved performing individual searches for the terms in each concept, then searching for each term separated by OR. I then combined all terms in a final search, separating each concept with AND. After performing this search and receiving numerous results that were unrelated to my topic, but where the author's surname was spelled HAES, I redid my final search, removing HAES. My final search was people or adult or men or women, and health at every size, and improved health outcomes or health improvement or quality of life or disease risk. I performed the same search in several databases. For PubMed, I received 7 results. For Scopus, 10 results. Cochrane Library, 3 results. Medline produced 13 results. CINAHL, 2 results. And HealthSource Nursing Academic Edition, 3 results. From these, I selected 6 of the best articles based on the types of reports and the studies conducted. The following are some of the results from the 6 articles studied for this report. A randomised controlled trial investigated the long-term effectiveness of a weight-neutral program versus weight loss program. It was found that participants in both programs were successful in changing factors such as physical activity and fruit and vegetable intake, perceived quality of life, and self-esteem. Participants in the weight-neutral program significantly reduced their LDL cholesterol levels and maintained the reduction at 24 months, whereas those in the weight loss program did not reduce their LDL levels. A greater improvement in dietary behaviour was seen in the weight loss program participants initially. However, at 24 months, these improvements decreased in the weight loss participants, but were maintained in the weight-neutral group. In a randomised clinical trial, participants were assigned to either a diet group or HAES group. Both groups showed improvements in depression, eating behaviour, attitudes toward food, and energy expenditure, as well as a decrease in LDL cholesterol and systolic blood pressure after the initial 6 months, but only the HAES group maintained these changes at follow-up. The weight loss in the diet group at the program conclusion was gradually regained, while the HAES group maintained weight throughout the study. Another study investigated a program incorporating health at every size used to enhance the physical and mental health of obese women with depression without encouraging weight loss. After treatment, self-reported depression scores and depression diagnoses had decreased, obesity-related quality of life and body image acceptance had increased. There were also improvements in systolic and diastolic blood pressures, which were sustained at the 3-month follow-up. Overall, the Health at Every Size program was shown to increase intuitive eating, which positively related to improved diet quality, including better fruit and vegetable intakes. The program also improved participants' physical activity level, and improvements were seen in cholesterol levels, cardiorespiratory fitness, and systolic and diastolic blood pressures. Quality of life, eating behaviours, and psychological factors such as depression and attitudes toward food improved, as well as self-esteem, which was found to be a major predictor in regulation of body weight. Of the participants in weight reduction programs who experienced weight loss, some maintained the loss by the follow-up and others did not. Overall, participants in the HAES programs maintained more positive behavioural changes than participants in other groups. This program promotes healthy lifestyle changes that may be sustainable for people with a high BMI and may positively impact cardiorespiratory health, psychological well-being and weight management, and benefit those at risk for type 2 diabetes and cardiovascular disease, demonstrating that health improvements can occur through behaviour change independent of weight change. The evidence is quite strong, as 3 articles used were Level 2 randomised controlled trials, 2 were Level 3-2, and 1 was Level 4. I graded the body of evidence as a B, which states that the body of evidence can be trusted to guide practice in most situations. At this stage, the evidence can be applied to premenopausal women. However, there are several limitations in the research. All the articles that appeared in my search related to women. None of the studies were conducted on men, and the women were predominantly Caucasian. Questionnaires were completed at home by some participants, which may have impacted the results. Some samples were quite small, particularly because in several of the studies only half the participants attended a majority of the program sessions or were available to complete follow-up assessments after the intervention at 24 months. Longer trials are needed to determine the long-term effects of weight loss versus weight-neutral programs, and a longer follow-up period may be useful to determine long-term benefits. Although our society places a major focus on being thin, this has not produced healthier bodies. Obesity rates continue to climb as many people diet to lose weight, are unable to maintain that loss, and then regain the weight. Not only is this cycle often repeated so people don't reap the benefits of sustained weight loss, but it can also produce a preoccupation with food, low self-esteem, and eating disorders. A health at every size approach focuses on healthy living through a weight-neutral approach rather than focusing on weight loss and dieting. It emphasises listening to your internal appetite cues, finding joy in movement, and connecting with others socially and emotionally. This report has found that a health at every size approach may be a sustainable method for people who are overweight or obese to improve their physical, mental, and emotional health, regardless of whether there is a change in their weight. In future, it would be valuable for studies of both males and females following the HAES approach to be conducted, and a longer follow-up period would be useful in determining long-term benefits of the program. It's important for health professionals to increase their understanding of the struggles that overweight and obese individuals face, and may be beneficial for them to become familiar with an HAES approach to health promotion. Caloric restriction may not be the only method of improving the health of someone with a high BMI, but rather a non-diet approach to creating a healthy lifestyle may provide a sustainable method for obese individuals to improve their health.